30 health officials expect a triple threat to your health with the flu, COVID, and RSV circulating all at once for the second year in a row.
CBS 58's Stephanie Rodriguez joins us now with more details on how you can protect yourself and your family. Stephanie.
Amanda, Mike, as the holidays approach, respiratory diseases aren't far behind. With more get-togethers and more time with loved ones on the horizon, doctors say now is the time to get vaccinated if you can.
Our number of hospitalizations have increased significantly and doubled also over the past week for both RSV and flu.
The Wisconsin Department of Health Services expects this respiratory season to be dangerous.
We've had 60 hospitalizations for influenza. That compares to about 35 for the previous week.
Right now, respiratory syncytial virus, or RSV, is hitting Wisconsin and the Midwest hard.
As far as RSV hospitalizations, we are over 100 cases, and we've only are 15 days into the season where we are monitoring it.
Nationwide, the vaccine to prevent RSV in infants is extremely limited.
And it's very frustrating for us. We were hoping by now to have higher numbers of the children who had shots for nirsevimab, but that's not going to happen.
On Thursday, the CDC announced the release of more than 77,000 doses of nirsevimab, but it's not enough for the millions of children waiting for a shot.
We do know for a fact that some of the providers, even the large providers of pediatrics, are getting very small amounts of doses, sometimes less than 5. That doesn't go very far.
However, pregnant people between 32 and 36 weeks of gestation have a separate vaccine option to fight RSV.
That will give maternal child antibodies to the baby once the baby is born for up to 6 months.
Meanwhile, health providers are asking the community to get their flu and COVID vaccines now, as current numbers are lower than normal.
It's not too late to get those vaccines at this particular point. We never have enough people being vaccinated, to be honest with you.
Because the RSV vaccines are so limited, infants with high risk of infection are being prioritized. There's also an RSV vaccine for people over 60. Doctors recommend you get that with your COVID and flu shot. In studio, Stephanie Rodriguez, CBS 58 News.